Alright, be forewarned, this isn't really that much of a money episode. I mean, it might be depending on where you're from, and since you're paying for it, it's important that you benefit from it anyways, so I guess it kind of is. Anyways, the topic today is healthcare, and more specifically, the healthcare available to all legal residents of the Republic of Korea. You're watching Sekkider, and today we're talking about the National Health Insurance Plan. Now, if you're new to Korea, chances are you've never heard of this, and if you're not, there's still a good chance that you may not have heard of this. So here's a quick introduction from the National Health Insurance Service, or the NHIS, whose English website I'll link in the description box below. It reads, the National Health Insurance Program is a compulsory social insurance which covers the whole population living in the country. Major sources of financing are contributions from the insured and government subsidy, so taxes and whatever they take out of your paycheck. Now, here are two ways that foreigners can qualify for this insurance. First one, be employed. If you're employed at a school, a hagwon, a company, or anywhere where there's an HR or administration office, then it's compulsory for them to apply for your basic healthcare insurance. Dependents of employees are also covered under this heading. The other option is to simply be a resident. This means having stayed in the country for over 3 months legally on a legal visa, whether that means you're on a study visa or you're self-employed. Alright, so as mentioned, if you have an employer, it's their responsibility to sign you up. For the self-employed, you've got to go over to your nearest NHIS branch and apply there. All you need to do is bring your ARC and fill out the paperwork there. You lose eligibility in situations where you A. leave the country permanently, B. your legal period of stay passes, C. you're extradited, D. you die. There are also a few other reasons. Again, you can find that on the site, but those are the main ones that you're going to have to face. But let's get to the goods. What benefits do you receive from the NHIS? I'm gonna go down the menu. The most important thing that everyone should know about, since everybody is eligible for it, is the biannual checkup. This is called a 건강 검진. This checkup is a regular screening consisting of a quick interview about your lifestyle, where they ask you questions about underlying health conditions, irregular symptoms, smoking habits, drinking habits, and weekly exercise, that type of stuff. They also test hearing and vision, as well as conducting a uroscopy, blood test, posture test, breast radiography, and an oral examination. So basically they check your ears, your eyes, your piss, your blood, your back, your tits, and your mouth. Depending on your age, the screening may also include cancer checks for stomach cancer, liver cancer, colorectal cancer, breast cancer, or cervical cancer. For infants and children, the numbers go up in terms of how often they can do it. So if you're looking for specific numbers, again, head down to the description box below and follow the link to bullet point 1C. General screenings are conducted biannually and are covered fully by the NHIS. All you have to do is head to a hospital or clinic that administers the test, tell them you want to get a 건강 검진, and then go through the ringer. Sometimes employers will ask you to do a 직장 검진, which is virtually the same thing, but your employer pays instead of the NHIS. Results will come back to you or your employer within 15 days, but I've usually gotten them back within 3. Now for cash benefits. First, if you're physically impaired, the NHIS will cover up to 90% of the cost of supportive equipment up to the maximum subsidy amount. Next, if you have a baby, they pay up to 250K on your childbirth hospital bills regardless of how many children you have. Alright, now I'm going to go through this real quick, so pause it if you need to, but this refers to equipment and consumable refunds. The NHIS returns part of the cost of resources treating chronic renal failure. For oxygen recovery service, they pay up to 120 per month for home oxygen and 200K per month for portable oxygen. Diabetic consumables are covered from between 901 to 2500 based on the type. Consumables for self-catheterization return 9,001 per day for up to 6 items. Those with incurable diseases that require respirators are covered for either 535K or 356K depending on the type. And consumables are covered between 60K and 80K. Whatever your political beliefs, Korea's social security system aims to reduce costs for everyone, and whether you like it or not, you pay the fees. So make sure that you take advantage of the services that you get for free while you can. You can always get additional insurances for things like dental care, cancer, or death, but the NHIS aims to provide at least the most basic healthcare coverage for everyone, regardless of whether or not they can afford it. Alright, so that's it for me. If you found this helpful, please like this video, subscribe to the channel below, and add any comments or things that I may have missed. You've been watching Sekkider, and I'll see you next week.